White Coat Wonders, where I sit down with real-world physicians from all kinds of specialties to discover how they got here, what drives them, and what future physicians like us can learn from them. Today, I'm so honored to be speaking with Dr. Eric Pifel, a board-certified orthopedic surgeon and sports medicine expert who helps patients all over get ready for what they want to do next, whether it's running, fishing, golfing, or just living pain-free. Thank you so much for being here, Dr. Pifel.
Glad to be here, Ella. Thank you.
Okay, so let's start with your origins. You treat patients from ages 8 to 80. Was there something that drew you to sports medicine specifically, or what sparked your passion?
I grew up an athlete. I played baseball and soccer in high school and college. So I played all my life, spent a lot of time in the training room, had a lot of injuries, and those physicians and trainers and therapists helped me see a path that I liked. It wasn't what I started off in college to do, but it was something that became a passion for mine. So I've been able to push my passion for sports into helping others with their passion.
Okay, that's amazing. Before you were Dr. Pifel, what were you like growing up, and how did you know that medicine was your calling?
It was a long while before I knew that. Growing up, the only thing I wanted to be was a baseball player. That didn't work out, and certainly a lot of times when life gives you a curveball, you have to change directions. So I went to college to be a biomedical engineer. I could do math. I did not like math. So I changed my major about 2 or 3 times, and I said, maybe medicine. And the only medicine that I ever knew growing up in a small town in Ohio was family medicine. So I went to medical school to be a family doctor and specialize in sports medicine, but then I realized I had a passion for orthopedics. So I combined those 2 passions, and here I am.
Yay, that's amazing. You've worked with some intense athletes from roller derby to indoor soccer. What's one injury or comeback story that stuck with you till today?
I have a lot of great stories over 20 years of practice. I think one of my favorite moments for an athlete is one of my professional soccer players tore his ACL in a season. So he went through all the rehab. He's from out of the country, and he was here all alone kind of doing his rehab. So he relied on me and my team significantly through that process. And he came back, and in the first game, in the first 5 minutes of the first time he played after his injury, he scored a goal.
Hey.
And then he turned, he looked at me, and he ran over, and he signed a ball, and he gave it to me. And I will never forget that moment, because I love to see people get back to their passion. I don't expect any payment other than their satisfaction that they're able to proceed, but that made me truly feel part of the process. I won't ever forget that moment.
That sounds so amazing. Oh my goodness. You specialize in minimally invasive procedures. For those who don't know what that is, could you explain what it is and how it's such a game changer in recovery?
When I was a young man in high school, college, even into medical school, a lot of the procedures we did in orthopedics were through larger incisions. So for an ACL reconstruction, we'd have incisions like this long, or for some hip surgeries, we'd have to have open surgeries. Now with newer technologies, especially with arthroscopy and the ability to use arthroscopes or cameras, especially with the technology advancing exponentially, it allows us to do things through smaller incisions. Smaller incisions are nice because they have smaller scars, but they're also much less traumatic for the patient. And that means a lot less pain at the beginning and a lot less scar tissue to work through in the recovery process. So it's overall, it's easier for me and for the patient, and therefore the technology is allowing us to get people back to their activities faster.
So it shortens the process and it hurts less.
Yes.
That's amazing. You're known for tailoring your care to each patient. What was one example where a standard approach did not work and you had to fully adapt?
Well, I would tell you that almost every patient needs some type of tailoring. We, just like everything in science, have a bell curve of extremes of people that can tolerate things or need things, but we have this bell curve of normalcy in the middle. Almost everyone needs some tailoring, a part of it, but I will tell you that I think the people that need the greatest amount of tailoring for return to sport are flexibility athletes. So if you look at gymnasts, especially because they have the need to be flexible, to be strong, but also to be stable, that's the hardest athlete to deal with for me, that needs the most tailoring of their process. So a gymnast with hip impingement, which is an entity where there's tearing of cartilage and that, in order to get them back to sport, not only do we need to stabilize things, we still have to allow them to have flexibility. Because if you allow them to be strong and less painful but don't have the flexibility, they can't compete. So in those types of situations, we tailor it differently, because we will repair things, but we also try to maintain flexibility without getting stiff. If I have a football player that has the same injury, I allow them to get a little bit of stiffness because they can still participate at a high level. So I think flexibility athletes like dancers, gymnasts, ballet, all these flexibility sports, those are the ones that I need the most tailoring.
Okay. Between surgery and teaching and team physician roles and conferences, how do you manage your energy and stay centered when there's so many people that depend on you?
I think it goes back to being a physician. Being a physician and doing medical school is not hard. There are many more technical, difficult things to understand. The hardest part about being a physician is time management. And I learned at a very young age, because I grew up in farm country, to get up early, do things when everyone else is asleep, work out every day, create regimen, don't go off regimen, make sure that you're following your own daily goals, and always do something for fun, even for 15 minutes. Create some type of escapism in your day, put that in your daily budget for your routine, and it's allowed me to stay centered. It's hard to be a physician sometimes because you have so many hats you have to wear, like you described, but finding a regimen, sticking to the regimen, and if something goes wrong, find your way back to the regimen has been the best way for me, but also finding some type of joy, escapism every single day. So that for me, I either read, I will watch an idiotic TV show, I will play a video game. I'm a video game nerd. So there's many things that you can do that allow your brain to relax from the craziness of a day.
You sound like my mom a lot. She did engineering and medicine. My whole family's in medicine, and she would always, like, at the end of the week tell us, like, or like finals week, she'd make us do something to, like, relax and not be so stressed out. What advice would you give to high schoolers who think they may want to become surgeons but don't think they're cut out for it yet?
I think just like any part of life, if you don't experience something, you are never going to decide whether or not it's something for you. If someone told me when I graduated high school I was going to be a surgeon of any variety, I would have laughed. So I think if someone has a goal to be a surgeon, first of all, you need to consider, do you have the ability to tolerate the chaos of a controlled environment like surgery, which is crazy and calm all at the same time? Can you tolerate blood? Because if you can't see someone have a nosebleed, or if you can't gut a fish and without it being a problem, those aren't for you. But also make sure that you have manual dexterity. I know I don't look like it, but I played piano for a very long time. I did woodworking and all types of tool working with my dad and my uncle on the farm. So understanding the mechanics of using tools, having manual dexterity, are all things that you need to take into consideration. So how do you do that as a young person? Make sure that you've kind of checked some of those boxes off as far as how your body responds to stress and blood and things like that. Make sure that you do things that are good for manual dexterity, but then observe. There's always opportunities at a young age to observe the surgical process, even in the high school level, to be able to get in and say, hey, that's something I want to consider. Now, early in your career as a high school or even college student, just a little bit of observation will at least give you some idea, is this something that I would like? Because the idealized role of surgery on TV is not how surgery is. But I think getting some experience, shadowing surgeons, talking with surgeons about some of the rigors is a good way to start.
I'm going to start shadowing next week in the OR for a cardio surgeon. I'm super excited. Looking back, what was the hardest part about medical school residency that nobody warned you about, and how did you push through it?
I think the hardest part of medical school, and I alluded to it earlier, is time management. In college, I played sports, I had a job, I volunteered, I had friends, and I got good grades. I thought I had everything figured out, and it wasn't a problem. Then I got to medical school, and the volume of information simultaneously, that's the most complex thing. It is figuring out how to do all those things and still have a work-life balance. So I think time management is the hardest thing that no one told me. Everyone told me medical school is going to be hard. The information was not hard. It wasn't hard to process. It was a lot of things to digest. But I had much more technically difficult classes in college that the concepts were harder. The concepts of medical school aren't hard. It's just the volume of information that is given to you all at once, and you're supposed to retain it all at once. So it's trying to figure out how to do that and still have some semblance of your life.
Priorities matter a lot. You've done research, taught at medical schools, and spoken at national conferences. What keeps you still excited about this field after all of these years?
Well, I think the number one thing that makes me feel happy to come to work every day are the stories like I told you about my athlete. People come in and are gracious and appreciative. They smile, they give hugs, they will drop off a box of cookies. I think the gratification of getting someone back to their passion is my passion. I wish I could be an athlete that is making his life playing a sport. I can't do that because it wasn't good enough. And I was self-selected, or I was selected, however. But the ability to see someone's joy when they feel better and get back to whatever they do. You don't have to be a professional athlete to be elated to be able to do something. I had a patient come today and she was so happy that she could go hike in a national park after 2 years of not being able to walk. So these are scenarios where I always look to the happy faces that give me joy because I have given them opportunity.
That's truly amazing. If you could go back and give your 15-year-old self one piece of life advice, what would it be and why?
I think take more chances. I grew up in a very small town, very colloquial, very close-knit. Everyone knew everyone. And so you felt very safe in that environment. I went to bigger schools as I went along, but I didn't take chances right away because I was afraid. I think if you're my 15-year-old self, I'd say, take more chances, try more things, and worry less about what other people think about it.
Dr. Pifel, thank you so much for sharing your story and your wisdom today. You showed me that your work is not just about medicine, it's about restoring people's lives and passions back. I hope future students, athletes, and anyone curious about orthopedics feels inspired by your journey today. If you liked the video, make sure to drop a like, comment down below what specialty you'd like to see next, and subscribe so you don't miss the next one. Thank you for watching.